And let me once again officially welcome everybody to today's webinar, Leading for Outcomes, Best Practices in Human Services. Today's webinar is sponsored by the Government Innovators Network at the Harvard Kennedy School and the Leadership for a Networked World. Today's webinar is moderated by Dr. Jerry Mechling, who is the Director of Leadership for a Networked World. Dr. Mechling.
Thanks very much. I'm delighted to be here. I'm delighted that everyone else is here as well. We clearly have a set of important issues to discuss, to put some ideas on the table, and then to see where we are. People have been working on human services problems forever, and will continue working on them forever. And as we do it, we have to design the processes we use to try to add value to those problems. And we also have to think about the feedback and control that allows us to adapt these processes to the particular situations that we're working on. And while human services problems have always had those elements, the thing we're going to look at today is 2011, what's changed and how we need to change to deal with that. So let's start just with a few definitions and some of the elements we'll be working with. We're going to talk about process design. How do you lay out the steps by which the human services problem will be addressed? And control. How do you gain the feedback you need to understand what's going on and to coordinate things well? We want to look at the key trade-offs in design and control issues and the trends that are shaping things, and more particularly, how we are going to respond to those trends. Okay, let's start with design. The fundamental element of design is to define what you're going to do, and what's important is the boundary that keeps you from doing other things. The idea of design is to stick to your knitting. That is, if we focus on a well-designed process, we tend to do efficiently that which we can predict in advance and know we will use again and again. So the upside of most design that focuses very heavily on doing what we've defined is efficiency. There's some downside to some of those concerns that we also need to be focused on. And the downside is the trade-offs. When we are too focused on the processes defined in advance, we can miss the cross-boundary problems and solutions. Those things that go beyond our particular program or the particular element that we're dealing with and require collaboration that goes across those boundaries. We can also, by focusing very much on the routine, miss the need and the capability for innovation that's required to adapt as things change and go along in that fashion. So we always have trade-offs between sticking to the knitting kind of focus and the cross-boundary innovation that may be necessary to get to the non-routine problems or the evolving problems. Beyond design, we have the issue of what feedback do we have to collaborate and control things. Are we looking only at inputs, but the inputs go to some process that we use. The process creates outputs, and the outputs, in interaction with other things in society, create the outcomes that we really care about. Broadly, the trend goes from inputs that are very precisely measurable, and therefore we can control them, but we're not so interested in them as mere inputs. We're interested at the other end of the spectrum, the outcomes. But those things can be both more uncertain and more difficult to control. So classically, what we've had is that businesses, on average, they look at the control feedback process, put a lot more weight on the outcome side, largely because they're reasonably happy that profits is a pretty good measure for the outcomes they care about. That makes them quite different from governments. Governments tend to focus very much on inputs, your staffing levels, and your budget allocation, and the process. Are we following the authorized process that allows us to cope with these problems well? The interesting element here, or many interesting elements here, if I can get my slides to work. Let me try this again and do this technology development. You said.
Well, I think it's going for most people, it's just not for you.
It's just not for me, I see. So other people can see these things. We have some trends that are changing in government, our balance, in terms of how we're trying to understand these things and respond to them. And the big trends are the following. We all know that the year 2011, the ones that have preceded it and the ones that will follow, are distinguished by much more turbulence than we've really had to cope with in most times previously. The finances are horrible. They're very unlikely to get much better. The demographics suggest that downstream, in fact, they'll get substantially worse. At the same time, our finances and turbulence in the policy environment are getting worse. We've got information technology offering us incredible economies of scale, but also opening up the downstream information that can be fed back and used to collaborate and control much more efficiently. So what this means is the yellow, I think it's yellow, I'm colorblind, but there you go, is that the trends are creating the possibility and the need to handle innovation more. There's more turbulence. We must innovate more. And we must do it on a cross-boundary basis because the root problems to most human services situations are broader than individual programs. But beyond the focus there on process design, we also know that we have an ability through information and information technology to do a much more cost-effective job at collecting output and outcome information. So what do these trends really mean for us as a conclusion, and what kind of conclusions do we really want to explore today to see what's really going on concretely in the world? The first one is that we need to focus more on innovation, more on cross-boundary work, and specifically today, more on outcome and the leadership that's required to get to the right outcomes. What that also means is that we have a learning curve to cope with in managing human services better over this multi-year period of increased turbulence and information capabilities. By and large, we're moving from an early stage of handling the defined processes well, the regulated procedures that we must comply with, to growing then to collaborating more on a cross-boundary basis, a rather voluntary cross-boundary set of activities, to defining new governance structures that integrate more tightly across the various boundaries that would allow us to also seek more downstream outcome and output and outcome results. And finally, to generativity, our word that looks at the kind of goal of capacity that we're seeking so that we in governments can resolve these problems as best we can. So, having looked at those elements, let's turn to three particular probes into what's concretely going on. I want to talk to Tracy Wareing, to JudyAnn Bigby, and to Jerry Friedman. Tracy, from the American Public Human Services Association, has some views as to what's really happening in the field. JudyAnn will talk about what Massachusetts has been doing, a probe more in depth at a particular concrete case. Jerry Friedman will be looking in particular at the kinds of technology tools that have evolved to allow us to do new things. As we go through these, queue up your questions because we're really trying to set the table for how we can, this year, respond and do better by the outcomes orientation that we have. Okay, Tracy, let me turn it over to you and what you were seeing at the American Public Human Services Association.
Great. Thank you, Jerry, and welcome everyone to the call today, and a special thanks to the university for their support of human services and for bringing us together today. I understand we have folks from around the world on the webinar, and that's great. So I think, without a doubt, focusing our work on meaningful outcomes is clearly one of the greatest challenges facing health and human service agencies. Yet, if we resolve it, it will be one of the most rewarding changes to our way of doing business. Of course, much of the challenge comes from the very structure of the programs we are charged with administering. Nearly every one of them is a silo unto itself with a different set of eligibility tests, measures, oversight mechanisms, and funding requirements, and some of the process points that Jerry just made. But many of the families coming into our doors, of course, have needs and concerns that only a holistic approach can truly resolve. So our current divided approach, which flows really from the federal level and has necessarily been reflected in how most of the agencies at the state and local level are organized, has to be overcome by a combination of both kind of the innovative management that Jerry just spoke to and policy reforms. So in the few minutes we have today, I want to share 3 critical leadership principles that both current and past human service leaders have told us help move their organizations toward a client-focused model. So I know I'm just going to touch the surface here. It's a pretty 50,000-foot level, and look forward to the Q&A. Move through the slides here. In terms of being able to identify the barriers and myths that we've created, I think we have to recognize within our own agencies that there are steps and requirements in our own internal business processes that may have had good reason for coming about, but have now become habits that are installed in the fabric of our systems and may prevent us from moving forward. There have been many states and local agencies that have made progress in this area. But the recognition, and this comes from many of our members of the association who've shared this with us, really it's about understanding that our processes and requirements have taken on their own life in some cases. And when examined closely, they can be found to be unnecessary. Indeed, too often, no one even knows where the requirement originated, and often duplicative. So business process reengineering requires some risk-taking and some strong leadership. We have to have the courage to examine our own practice and beliefs and resist the tendency to place blame elsewhere or fall into the quote-unquote way we've always done it syndrome. And managers have to set aside some long-held assumptions about the best way to employ resources. But with the mismatch we now have between demand and resources, such changes can literally make the difference in whether agencies can not only keep up with their workloads, but devote the attention necessary to achieve the real results rather than the process requirements. So bottom line here is we're really talking about championing reform from the ground up and demonstrating what works by recognizing that there's much within our control. Achieving true meaningful outcomes requires the broader community to share responsibility for them. I think a lot of folks have talked about the concepts of shared governance over the past few years. And if we look at the immediate concerns that our clients present when they come to us, not enough money or food, problems in caring for their children, the need for medical assistance, they all come out of a far broader context that may include lack of work opportunities, education, housing needs, family supports, or services for such problems such as mental health. So putting our families on the road to a dignified and self-sufficient existence cannot be accomplished by the human service system alone. Human service commissioners throughout the country have routinely expressed the need for shared governance with others in the human services ecosystem. It's one of the essentials of successfully managing their agencies. Shared responsibility plus shared strategy helps lead to the shared outcomes. In engaging this broad circle of stakeholders through effective communication and asking them to join us in leadership will widen our circle of influence and bring us additional resources and partners. So education, public health, labor, community planners, business, philanthropy must all be at the table. Really, the building of a coalition is the key to driving the outcome-focused work. And then really the third point here is that we all have to participate in the changes we'd like to see at the national policy level with a focus on integration, innovation, efficiency, and solutions that are going to be sustainable. I think we've seen some welcome advances in the federal-state relationship that have reduced the time and resources that states are expending on meeting process mandates. But we still have a long ways to go with respect to national policy. Program requirements remain too dissimilar, despite the fact that most serve the same families and are handled by the same caseworker. Too expensive to administer because of counterproductive verification rules or reporting mandates and rigid funding silos. We remain too focused on the means of delivering benefits rather than what the real differences are for the programs to actually make a difference in people's lives. And all too often, too difficult to modify when effective new business processes and funding approaches have been identified. If we are going to impact changes in the policy that shapes the programs we deliver, we have to do it collectively. At APHSA, our priorities for Leading for Outcomes are focused on two strong and parallel efforts. First, we will continue our intensive and very promising work with partners such as Harvard to identify and share the nation's most innovative ideas. It's about spreading what works and showcasing why outcome-driven programs must drive future human services policy. And this webinar is just one example of that kind of effort. And second, we will continue our long-standing efforts to engage national policymakers in this urgent conversation through a strong policy agenda, effective partnerships, and pursuit of new opportunities that are now coming into play. And just to give one example that bears on a new opportunity that really directly impacts outcomes is the current administration's support of pilots to identify burdensome regulations, reduce program conflicts, and tie program implementation and funding to meaningful outcomes. There's a lot of conversation happening with the Office of Management and Budget and the federal agencies who fund human service programs in this area. We're closely involved in those efforts and encourage wide participation from among the state and local agencies and anyone involved in the system, whether you're a state or local government leader in human services, a leader within the nonprofit organizations, or an industry partner, to come together and join us in pursuing outcome-based reform at the national level at the same time that we're moving forward with promising practices in the states. And just to leave here with, I think, an appropriate cartoon to say many of us, I think, are done admiring the problem. We are here to work together to drive the transformational change needed to make sure that the outcomes are really about better, healthier lives for children, adults, and families. And I look forward to your questions.
Super, Tracy, but before we turn this over to JudyAnn and then to the larger audience, let me take my prerogative, which I enjoy, and follow up with a question. If we, in general, are both trying to follow the rules, but occasionally saying that's too siloed, and we do need to cross-boundary, do cross-boundary stuff, and we also need to do more outcomes-oriented stuff, can you give proof that there's a there? Can you give me an example that's recently been a success at the cross-boundary outcomes-oriented kind of change we're looking for?
Well, sure. I think that many states have experienced the ability using technology to bring different programs together into one application, for example, that ultimately means that that families are getting the services that they're entitled to, that they're getting them more swiftly, and that really is something that if we could have more waivers as to program requirements at the federal level could probably go to a whole different level. But lots of innovations happening across the country using technology, and I think Jerry Friedman's going to speak about this a little bit more in a few minutes. But I think we have lots of ideas out there, lots of things that are happening at the local level, and the more that we can showcase those and bring them forward, the more likely that we'll have the ability to do the parallel effort, which has really changed the national policy.
Very good. And as we go, think about also the downside, which I know a lot of folks have in the back of their minds, if not at the front of the table. Are there any examples of people who have tried to do this and run into the maw of federal enforcement or other things that created a crisis for them, and anyone that stepped too aggressively and too far across these boundaries, or looking at outcomes-oriented as opposed to just process-defined ways to go about problem solving?
Yeah, I think that that's a really good thing to have in mind, but I would also caution that it doesn't that the caution doesn't keep us too cautious, if you know what I mean. I think that we are at a stage right now where there really is a convergence. I think you spoke to it in your comments about the turbulence. Really, there are a number of things that are very difficult and being faced by the states, but at the same time, the political will and the understanding that we need to do things differently really seems to have come together. And so I would say that even if folks have run up against a wall in the past, it's time and ripe to challenge it again. And I'm hearing that a lot also from the conversations we're having at the federal level, that federal agencies, OMB, Congress really want us to bring the innovations forward, even if we've tried to before.
Super, super. As we turn to you, JudyAnn, in Massachusetts, can you lay out concretely what Massachusetts is doing vis-a-vis this, and how the issues that Tracy laid out are playing here?
Yes, thank you very much, Jerry, and thank you, Tracy, for that really helpful overview of what the high-level reasons for doing this are and the approaches. In Massachusetts, the Executive Office of Health and Human Services is really the intersection of health and human services. It includes 16 state agencies, including our Medicaid program, public health, mental health, child welfare, veterans affairs, everything that you can think about in human services. And there truly are 16 state agencies. When I arrived as secretary, each of these agency heads were direct reports directly to me. And it was certainly challenging to not think about the work that they were doing in silos. The budget for Health and Human Services is actually about 50% of the Massachusetts state budget at $13.5 billion. There were 22,000 employees. It's down to about 19 now. But we also do over 5,000 contracts with about 1,000 human service providers. So just the organizational structure in and of itself is extremely challenging, and the thought of people thinking about not their own populations, but the families and individuals we serve, many of whom are involved with 5 or 6 different agencies, was really something that I took on when I became secretary. As I began to think about what I wanted to do in terms of approaching the challenges that I faced by the organizational structure of Health and Human Services, and therefore the budget and the the governance of these issues, we started out on a path basically that came out of my first budget discussions with agency heads. I would hear about the line items that needed to be preserved or sometimes programs. But when I started asking about, well, what does this program do? Are we achieving the results that we want to see with this program? What I found is that there was very little information about outcomes, and it was very difficult to try to tie a budget process to outcomes because there was so little information known, not simply about the outcomes, but also how many people are being served. Are we achieving what we need to achieve in terms of serving people? So at the beginning of the Patrick administration, we began this initiative, which we call EHS Results, and we we created a process where agencies came together and started to develop strategy maps which were tied to very specific strategic goal areas. The strategy maps were designed to answer two questions. What should EHS be delivering to Massachusetts residents, and how will we know whether or not what we're doing we're successful in terms of what we need to accomplish? So the maps that we developed articulate what the goals are. There are sub-goals as a part of the primary strategic goals, and then there are outcome measures tied to the sub-goals. We did a combination of trying to take whatever existing information we had, but thinking about we can't just settle for what we're currently measuring or what we currently can measure. We really need to be thinking about what do we actually want to measure, and so we developed new and future measures as well as looking at what existed. Here you can see the strategic goal areas that we've identified across all of the EOHHS agencies. The first one is educating kids in our care. This acknowledges that within several of our agencies we have care and custody of kids, and one of the things that we wanted to make sure is that kids who either left the system or were coming in and out of the system did not suffer in terms of their education, and that we were paying attention to whether or not there were appropriate services in place to maximize school attendance, to hold people accountable for the education that kids in our care and custody were receiving, and to maximize success for kids. The next strategic area is community first, and this is related to our policy of moving people out of institutions into the community with the appropriate community-based long-term supports. Massachusetts, at the time that I became secretary, had 6 institutions for developmentally disabled individuals. We made a decision to close 4 of those institutions and move people into alternative settings, but this Community First agenda really permeates all of our agencies, from the services that we deliver for veterans to our mental health services to services for elders. So it applies to all populations and really does define what our primary goal is in terms of supporting people living in the community. The third goal is effective government. I'm not going to say very much about that, but it is focused on making sure that we're delivering services in a way that values customer service and clear performance objectives. Our fourth goal is jobs and self-sufficiency, again focused on populations that we serve across many agencies, with a goal of changing some of the programs that we'd been delivering for decades, for example, sheltered employment programs to more integrative programs with partnerships with employers. Safe communities is another goal that we have that is related to making sure that kids who are in our care and protection are actually protected, but it also relates to elders who might be experiencing abuse or neglect, and also our violence prevention efforts in communities, as well as safe housing. And then the last area is wellness and the quality of health care, where we've made a tremendous effort to ensure access to care, to advance healthcare quality, to contain costs, promote wellness for individuals and healthy communities. And this obviously is very important to us as we were implementing healthcare reform, but it reminded us that healthcare reform was not simply about getting insurance for everyone, and that this effort on healthcare reform was not simply something that was delegated to our Medicaid program, but there was a way for all of our agencies to participate in some way. So, for example, in all of our Department of Public Health programs, one of the efforts that the staff really had to engage in is, why are these individuals showing up in public health programs if everyone is eligible for health insurance in Massachusetts? Why aren't these people signing up for coverage? And so it sort of turned the tables on DPH's role in that regard. So this next slide gives you an overview of the internal reporting that we use to evaluate the progress that we're making toward our goals, and helps us evaluate performance. We look at each of these strategic goal areas and actually develop a dashboard for each goal area. You can see through this schematic on the left-hand side, there might be particular goal areas with different outcomes, and we monitor whether we're green, yellow, or red. We also look periodically at the outcome measure details so that we can look at sub-goals and understand where different goal areas might have more challenges in terms of helping us reach our overall measures. I use these types of reports when I meet with managers on a monthly or quarterly basis to understand the type of progress that we're making. It actually has been an incredibly helpful tool to understand the impact of some of our budget cuts. So, for example, I know that there are areas where we're making clear progress in improving performance in different areas, and then as we cut the budget, I saw some things reverse in a way that was not a good outcome, and that really challenged whether or not we were able to keep communities safe or populations appropriately housed or jeopardize the health and safety of communities. So it's been extremely important in helping us make further decisions about where we could target budget reductions, for example. As I said, one of the ways that we're using this process is through the way we think about the way managers are assessed. We're in the process of using EHS results as part of a way to incorporate into manager reviews their roles in helping us achieve results. We're using the performance information in leadership meetings so that we can focus on cross-secretariat outcomes as opposed to outcomes in individual agencies. We, as I said, are using it in our fiscal year priorities. We are also, as I said, looking at how different budget cuts affect service delivery and certain populations, and also looking at the impact of policy decisions on service delivery. One example that I can give you there is we had a restructuring of the way we managed our child abuse and neglect reports, and one of the ways that we've been able to tell that we're actually improving both the internal management of those reports and outcomes for kids is that we have measures before this change was implemented and ongoing as the change is being implemented that shows us what's happening to the reports, how long it takes for reports to get through the system, whether or not kids who are actually being reunited with their families are being re-abused and that sort of thing. So it has made it very helpful to assess some of the changes in policies that we've implemented in our agencies. I believe that's the last slide.
Sure. JudyAnn, before I turn this over to Jerry, let me ask one quick follow-up question to you, which is we can see that EHS Results has put a lot of effort that many jurisdictions haven't yet into measuring outcomes. And in general, some of the things you're doing with those, do you have a particular poster child example of a decision that's recently been made differently, a priority that has changed because of this results program? Can you give me an interesting result from the EHS results?
I'll go to our Community First program. We, as we thought about community living, it was really focused on individuals with developmental disabilities and moving away from institutionalized settings for several hundred people in the 6 facilities that we were running. Massachusetts is unique in that in all of the New England states, I think there's only 1 or 2 other institutions that provide 24/7 living for people with developmental disabilities. And so our goal was to change that mindset in Massachusetts. But as we began to implement that program and we took the principles behind Community First and thought about them more broadly, we actually found when we started looking across all of our agencies where we had some responsibility for care and protection for individuals who were vulnerable, that we're spending much more money on institutional and residential settings than we had realized. So kids were stuck in psychiatric hospitals because that's what we paid for, and we weren't investing enough in specialized foster care, for example. We also found that we had people who were long-term admits to our mental health hospitals because we weren't investing in community supports for them. So it really opened our eyes to where the priorities were across several different agencies, and we could take this Community First policy and philosophy and begin to apply it across settings, and we've been able to begin to reverse the investment in institution or residential facilities versus more community family placements.
So the community first idea is now a much more evidence-based and strengthened community first idea because of the EHS Results Program.
That's correct. And when we look at things like objections that people have, well, if you take kids out of these residential settings and put them in foster care or reunite them with their families, they're not going to be protected. They're not going to be safe. Well, we actually have data that show that kids are doing better.
Mm-hmm.
They are protected. They are not being re-abused. So I think that it reinforces the position that reuniting kids in the community is a good policy as opposed to keeping them in residential or institutional settings.
Got it. Jerry, let me turn to you, and I know you've been looking carefully and for a while at how the capacities of information technology are making a difference in this field. Can you lay out some of those learnings for us, and then we'll turn to the entire audience about Q&A to take this set of ideas and try to make them as relevant as we can to as many people who are on the line now.
Thank you, Jerry, and it's a great honor to be able to participate in this virtual podium. My task today is to talk a little bit about the potential for technology to support an integrated outcome measurement process at both the individual client level as well as the program and agency level, as Dr. Bigby was talking about. I have to admit that it's a lot easier to admire this problem than to address it. I once heard a definition of services integration as an unnatural act committed by non-consenting adults. And it can indeed be a daunting task. If we could go to the next slide, please. Our siloed system creates inherent communication challenges, as Tracy mentioned, due really to the narrowed scope. It also creates multiple views of a client that it only may be one piece of a larger puzzle, as well as producing costly procedural redundancies and duplication in the system, particularly in administrative costs. In terms of the technology, the singular focus of federal, state, and local programs and their funding has contributed to the development of large monolithic systems that actually didn't talk to each other. Trying to address this, it's a condition that we used to call hardening of the categories. It is not new. Over 25 years ago, I participated in a federal client outcome evaluation project that involved 4 counties in Pennsylvania. It was very exciting. Simply, multiple categorical program staff, caseworkers from 4 different counties got together and they developed a problem identification and alleviation scale that measured risks across multiple problems and services. The fact that they could all agree to that was very significant, but it also was very person-centric and created a single view of a client. During a set period of time, over 1,000 cases at random as they came through the door at these categorical agencies across these jurisdictions were assessed at intake utilizing this integrated tool. And they subsequently then were reassessed at the 3- and 6-month levels to measure any change. The data, of course, was then aggregated, collated, measured, and put into a report. There were a lot of lessons. I think one of the most significant was the clients upon intake averaged 5 presenting problems. That kind of proved what we always knew, that no single agency could really meet all of the needs of most people that were walking through the doors. Second, the categorical workers were capable of identifying and measuring problems outside of their silos. There was a lot of apprehension, among staff, can I really understand this? And the third was that there indeed was progress and patterns of effectiveness, or in some cases lack of effectiveness, that was also significant that began to emerge. Well, one of the things that we also learned, unfortunately, was that it was a very intensive process that just could not be sustained manually. At that time, there was absolutely no computer support. And kind of based on that experience, personally I became a fairly harsh critic of the industry. Although we are 1/3 to 1/2 of most state and local budgets, the expectations were that we would develop algorithms to retrofit our requirements to meet business applications. And I can tell you from experience that it didn't always fit. We could go to the next slide, please. The good news is that today's technology provides tools that are available to help bridge this gap. And as Tracy mentioned, public policy is also leaning in this direction. I want to focus on three assets or enablers. The first is enterprise architecture. Simply put, and this is the 80,000-foot definition, it's the glue that bridges siloed legacy applications together to identify a full range of activities that a client or a family may be involved in. It allows the continuation of the existing investment in the infrastructure without ripping and replacing legacy systems, but gathers relevant data from multiple sources. The second is a master client index. This identifies clients seeking or obtaining services from multiple places. This identifier enables the collection of information from siloed databases to enable a more comprehensive services plan in a person-centric manner. It also requires data sharing protocols. We have a great example from New York City Connect. And finally, business analytics. There's a lot of attention to this. They can measure results and generate integrated reports. And I think even more significantly is that there is potential over time as the database grows to be a predictive tool to assist workers as they guide and arrange services and interventions based on presenting need and prior success rates. It also can be aggregated for program planning and evaluation purposes, much in the way that Dr. Bigby is doing in Massachusetts. One word of caution I'd like to just throw out there is that as technology advances, it is indeed remarkable. They are great tools. But you can't push a button and make this all happen. It is still very, very difficult work. The challenge is not the technology as it used to be, but it's the business processes, the rules, the policy, the politics, and the culture. If we can move to the next slide, please. With these tools in place, it does much to alleviate the challenges of our current siloed system. This results in better client service, easier access, no wrong door, a single view of a client, certainly better case management through better interagency communication. We know how each other is touching this family and this person. Better return on investment, leveraging the existing investments that we have in technology and providing greater efficiency, productivity, and accountability, and I would contend real savings, mainly through a faster pathway to self-sufficiency. If we're able to just shave 1 week off of our 4 major benefit programs, by doing this better, we can save $45 billion per year. That's where the real money is in human services. And by doing that, we'll be addressing what I think has always been our biggest challenge, our public image. We can be successful to the extent that the public has confidence in our ability to manage our programs efficiently and effectively. And we can address that by producing unduplicated client counts, generating a true cost per case, and by answering the long-standing question, after this huge investment in human services, are people actually better off? I think it's a really exciting time. I think it's been worth the 25-year wait for better technology. And I look forward to further discussion and to getting into this a little bit more in depth at the next Harvard Summit coming up and through the emails that we have been circulating. So, Jerry, I'll turn it back to you.
Super. And on a program that is looking at both cross-boundary collaboration and outcomes-oriented work, I want everybody to know that we will cross the boundary of the 3 o'clock end to this to extend it to 3:15 in order to reach our outcomes, which are an ability to address the questions that are flowing in here, which I want to turn to really right now. We have a question from Ileana for Tracy, which would be, where would the local agencies apply for the kind of waivers that you were talking about in service delivery on a cross-boundary basis?
Well, one of the things that I think that's out there now that I want to make sure folks are aware of is the Partnership Fund for Program Integrity Innovation, which is some limited funding that's come through the Office of Management and Budget. And there's a website, collaborativeforumonline.com, where you can go in and explore or advance ideas you may have about innovations, and they are examining those and potentially funding them. And that's one way to think about possibly moving forward in actually getting funding support to put some ideas forward. With respect to local agencies, I think the question becomes more complicated depending on what kind of system you have in your state in terms of local administered or locally run and state administered systems, and how much work you have to do through your state programs. But I think the point being that to the extent that you're getting or receiving funding from federal agencies, the reception seems to be there, and so I think you have to take a look at what are the particular program areas you're working in, and certainly from our association standpoint, we'd be happy, to explore in more specific detail offline anything that you might want to advance. We actually have a council that represents local agency human services, and they are looking right now, as a matter of fact, for innovative ideas to be able to take forward and test, so that may be another avenue.
Mm-hmm. Tracy, this is Jerry. I just wanted to mention that on Thursday, this must be webinar week, we're going to be presenting to the Collaborative Forum a regular webinar series that they have. So if anybody wants to kind of further this discussion, it's going to be on services integration. We would encourage you to plug into that webinar as well.
Super. Thanks, Tracy, and thanks, Jerry. JudyAnn, Sheely Thompson has a question about the EHS Results Program, and the question is, who participated in setting the EHS Results goals and in developing the measures that you ended up using?
So we actually broke our leadership team, which includes our agency directors, our general counsel, our communications people, our legislative people, everyone who is on the leadership team into groups. People could be in more than one group related to one of the strategic goal areas, and there was a group leader who was charged with leading the process to map out, to develop the maps with the sub-goals and the potential measures. I want to acknowledge that we had help to do this project from Accenture, and they were very helpful to us. Once those goals, sub-goals, and potential measures were developed, I reviewed them, and then we started the process of really figuring out what we could and could not measure. I thought it was a really good process. For some of our goal areas, we ended up with recommendations for hundreds of measures. Obviously, that's not really doable, and so it took a while to really review them and think about what were the best measures, and it's a process that's ongoing. We're constantly looking at this. But it was a cross-agency collaboration.
Russ Barron had a follow-up question to that, which is about the difficulty of this. How difficult was it for Massachusetts to align 16 agencies behind a common set of goals? And do you have any advice or lessons learned for other states from that experience?
I actually, there were two processes that actually went on at the same time. So as we looked at these Secretariat priorities, I encouraged the agencies to also develop their own priorities, even if they didn't bucket into the Secretariat goals. So I wanted to be sure that agencies could see something of themselves in the priorities that we set in the goals, and so that it was clear how agencies had some responsibility for helping us meet our goals. And I think that we were successful in that, but we did not take away the unique priorities and functions that each of the agencies had. I think this work is still ongoing. It's still very difficult. Truthfully, it's taken a very long time to move agencies away from a completely siloed approach to right now we're looking at administrative structures that can be realigned across different clusters of agencies, so it's ongoing work. So it didn't happen overnight.
maybe I missed one element. How close to overnight did it happen? How long did this process take?
So we actually started this process in 2008, even before there were signs of this terrible recession that we've gone through. We, as I said, we're continuing to refine this process, but I would say it took 18 months for us to get enough agreement and enough measures that we could begin to see some tangible results on at least a few of the goals.
Mm-hmm. I've been impressed over the years with people from Singapore talking to me about the implementation of things that are inevitably controversial in government, and their phrase is slow trigger, fast bullet, meaning in their case that they're willing to work on these controversial issues for some time in order to come closer to consensus if possible. But they're doing it with the view that once they are locking in to a particular deliverable and end result, they then work very hard at quickly showing the results, and not only just mobilizing the support group, but showing the results so that that group can stay mobilized, which I think is an interesting and a difficult problem often in government. We have another question here from Don Kay for Tracy, and it's the following. Tracy, I'm not hearing you say anything about the power of work and how it transforms a person's life. What linkages need to be reinvented between our nation's, quote, human service system and the, quote, workforce development system? At the ground level, there seems to be huge gaps between the two. One seems more aimed at taking care of people, and the other seems more aimed at enabling people to work, make money, and live fulfilled lives. Do you see any efforts on the horizon to close the gaps between these two systems?
Wow, that's an excellent point and question. I think the power of work and the focus of how it permeates so much of what actually then gets provided on the human services side of things is something that there's certainly discussion about, but I think at the national level we need to drive that connection in a greater way than we have. But it's got to be informed by what's happening on the ground, and I think there's a piece here that human services needs to take and learn from the workforce side, which is really, and I thought it was well articulated, which is really about how do we enable and how do we involve, of course, the clients that we're serving. There wasn't much said today about how important client voice is to the work that we're doing, and so I'd like to say that it's all ripe and ready to go, but I think it's an excellent point and one that we really have to take on and get our partners, both in the business community and in the workforce community, at the table together to figure out how we approach it in a much better way that leverages the opportunities of work and what that can bring to a family and a community.
Mm-hmm. Interesting. Let me turn a question to Jerry, who brought up the idea that it's been actually 20 years or so that we've been working with technology to make a difference in how we manage human services problems and their resolution. And the technology has been following Moore's Law, Metcalfe's Law, been getting better. What kind of things can we actually do now that we couldn't do 5 years ago? Is this something that there's truly some new capabilities that have just come into play, or have we just been too slow to use the capabilities that have been around for a long time?
Jerry, I think actually it's a combination of both. Certainly some emerging technologies, mobile applications, being able to use cell phones, smartphones, GPS systems, electronic notebooks that caseworkers can use are relatively new, and the application of those in human services, it's been fairly recent in terms of their involvement. I also think the use of Internet applications, how that has grown, and you know how remarkable that has been through the creation of portals and the ability to communicate electronically, where we don't have to have clients coming in and waiting in waiting rooms to produce changes in their welfare applications. Those are all relatively new. What I think has not kept pace, although there certainly has been improvement, is still the way that we procure systems in health and human services and perhaps even the public sector at large. In many ways, we're still clinging, I think, to some old paradigms in terms of the state's ability to make good, thoughtful decisions about procuring computer systems, utilizing the state-of-the-art. And I would also say in some states they're looking at antiquated terms and conditions that make it much more difficult to move in such a fast and nimble and agile way that we have to. You know, under the old paradigm, it can take 2, 3, 4 years to work through the approval process, the planning process, and by that time, the technology is obsolete. Again, and I think Tracy can confirm this, I think there has been huge advances happening, but from my perspective, perhaps not quickly enough. So it's a combination, I think, of emerging technology, use of new things like GPS systems and mobile computing, but also just our ability to procure the kind of core systems that we need.
No, I would certainly agree that procurement has remained a problem. There are swings to improve the way we handle it. I think we had a big swing about 15 years ago, and I am hopeful that we'll have another big swing coming around now. There was a follow-up question to you, Jerry, as you were answering this. Sheila Thompson brought the question up. Have you found ways to address confidentiality for substance abuse clients and sharing information across agencies? There's a technological capability to share, but how do you handle the confidentiality issues?
Well, what I would say, Jerry, that a great example would be the New York City Connect project. And this was really through the leadership of Mayor Bloomberg, who just simply said, you know, our agencies are going to be able to communicate together. Specifically around drug and alcohol protocols, I really can't address that. But what they did was that they put in a process where they actually went, I think there were something like 35 different programs and maybe 15 different agencies. And they negotiated the protocols data element by data element, stripping away some of the myths about what can and can't be shared, and also developing a framework for who can have access to what types of data. So, for example, a caseworker in one system, it may be okay for them to know that somebody is a client of a drug and alcohol agency, but they wouldn't have access to the case notes, to the therapies, to the progress, to the clinical kind of aspects of that case, whereas maybe a mental health worker in another system could have access. And they negotiated all that out, and then they used automation to kind of serve as the traffic cop for the flow of this information, who had access to what and for what purpose. But the bottom line was that they figured out a way to do it across all of these various programs. And so I would contend probably that that same process could be used specifically in the drug and alcohol arena.
We're going to have time for one or two more questions, and then I'm going to turn to the panel for some parting advice from this session. But Robert Hammond has a question, JudyAnn, for you. Did the EHS Results Program require legislative approval and appropriation? And if so, were recommendations from the legislative branch on performance measures integrated into the program?
So the answer to the first part of that question was no. We did not need legislative authority to do this, and we did not get a new appropriation to do this process. We used resources that we already had. We actually had 2 staff people who from EHS who worked on the project and who are responsible for working with each of the agencies to make sure that the data gets in, that the maps are developed, and that it eventually gets up to our website and to the reports that we use. We have not consulted with the legislature about the various measures. It has been helpful having done this work, however, in each of our budget hearings and meetings in the years subsequent to starting this project. We do have a few legislators who do ask about, well, can you tell me about your results? Can you tell me how many people you're serving? What kind of outcomes are you seeing? but we actually don't get those questions very often.
Mm-hmm. Very interesting. I'm about to turn it to the panel for some parting thoughts. I want to give to Palak Shah a small answer, and to everybody. The question was, what, again, was that saying from Singapore? The saying, for those of you who have your 3x5 cards ready, is slow trigger, fast bullet. And again, it's pretty obvious what they're meaning by that. They were actually talking pretty specifically to me in making contrast between sort of the Western leadership challenge of early deciding on behalf of everybody what we're doing, and people kind of quietly either agreeing or saying that they'll hold their disagreements until later, then subjecting the decisions to the great difficulty of problems that keep emerging during implementation that hadn't been thought about adequately in advance or committed to. They put a great store in making sure people have thought through the risks and then not letting those risks slow things down once the implementation starts. But as we're thinking again about these sessions of going to more cross-boundary, outcomes-oriented results in the human services domain, we've been talking here for a while. Tracy, what sort of parting thoughts do you have for us?
Well, just I think a couple of things, Jerry. One is the importance of the language we use. I was actually having a conversation internally in my office earlier today about how important it is in the way that we talk about the work that we're doing, and you know, being mindful of saying things like, I think the word for a while was shared ownership, and yet ownership, you know, still has this connotation of that something is yours and something is mine, and that we're really trying to get to a, you know, a visionary point here, and we really need to talk about shared responsibility and perhaps shared governance, but that we need to think about how we do that together. And so just thinking about how that plays out and having this communication, and if you're trying to drive change within your organization, being mindful about, you know, what the words are that you use and how it's heard. And really thinking about whether you have a practice model in place. Do you have the values and principles that underlie where you want to go in terms of outcome focus? And again, that's a basic statement, but sometimes we get so enmeshed in trying to just move forward that we haven't set the framework for that conversation. And so I think there's been some good materials that have been done, including some work that Harvard has done as well as Accenture to try to set that framework, and I'd encourage folks to go back and take a look at that.
Super. Thanks. And that from the APHSA umbrella view of what's going on in the world. Can we turn back to you, JudyAnn, for your parting thoughts from Massachusetts?
I think it's important to acknowledge that this work is hard, and to acknowledge that during any type of change process, people will have discomfort and feel like retreating back to the status quo. But once they get through that discomfort, on the other side, there is a new way of doing things and hopefully improved outcomes. So I think acknowledging that it's hard, that it can be painful and disruptive is important. I also think it's important to celebrate small successes. So, you know, I didn't get to rearrange 16 agencies into 4 or 5 or 6, but we do have evidence that we are working across agencies better, and people can celebrate some of the performance outcomes that we can point to in a collective way, and I think that that's important.
Super. Thank you very much. Jerry, what are your thoughts at the end of this session?
Well, first, Jerry, I have to tell you how much I like that metaphor of the slow trigger, fast bullet. It is much better than the ready, fire, aim that got me in a lot of trouble throughout my career. I would like to, I guess, confirm what Dr. Bigby was saying about the importance of this work. With the critical needs that we have, 44 million people now relying on the SNAP program, we simply can't sustain the old models that we've had. And so I think that there's an opportunity to use technology. It's not an elixir, but it is a tool But throughout all of this, through all of the discussions, it's very, very important to remember that the work that we do is absolutely critical, that at the end of all of the paper and the computer programs is somebody who's out there who's in real pain, who has real need. I used to tell my coworkers that, you know, a keystroke on a computer can make a difference as to whether a child goes to bed hungry or nourished. It is an awesome responsibility that we do each and every day. And so forums like this to help us learn the state of the art, I think, are just absolutely critical, and we feel very privileged to be able to be part of it.
Super. I'm delighted that the panel was here. I'm delighted that the audience was here. And I turn to this issue that we were looking at with due respect, I think, for the often denigrated word silo, which does suggest that there has been a time at which a particular problem was defined, and people were told to pay attention to that problem. And therefore, when you pay too much attention to only that problem, you can be missing the downstream outputs and outcomes, and you can be missing the need for cross-boundary. That is important, critically important, at a time like now when we have so much turbulence and demand for new ways to go about things, and so much capacity in the information technology that we have for organizing things differently. But they are difficult problems, as JudyAnn was saying, and they take a learning curve that's not just us individually, but entire institutions. This will take a while, and the best way in many cases to learn is to look carefully, to talk carefully to those who've tried some things that maybe your institution hasn't. So I like these kind of webinars where we have a beginning for those kind of conversations. And I like it when people come together, as we'll have another opportunity to do this fall, to kick the tires, to talk one-on-one, to look at these issues, because Lord knows we need progress on these things right now, and we can get it. I wish everybody the best of success. Thanks again for being with us this afternoon, and hope to see you soon.